the approval of our minutes.
I'll make a motion to approve the minutes as printed.
Second?
It's been moved and seconded. Any additions or deletions or comments? Hearing none, all in favor, please indicate by saying aye.
Aye.
Aye. Opposed, same sign, so ordered. We'll now go to reports of our warden.
I have nothing to add or delete, other than I just want to comment that we're still hiring. I want to thank Commissioner Litz. Commissioner Litz was able to point our Director of Training, Scott Richmond, in the direction of somebody that was hopefully going to be able to help assist with drawing some more applicants in for the facility. I also sent an email this morning, but I want to go on record to thank our staff. They are the unsung heroes that often aren't thought about and thanked during the conversations of essential employees, but they're putting a lot of time and hard work and diligence into being their correctional professional that we ask them to be. So I just want to note that for the board. Another on-taking that we took on was the progression of the GTL tablets. They're currently being put in. There was a target date of the 24th for a potential go live. That kind of got pushed back on the side of GTL and us with staffing. So we tentatively pushed that back towards September 1st. We still have a lot of work to do as far as education and training and notifications for the incarcerated population to explain to their families what the process is to use the tablets, etc. So those are some things that we're grateful that we're moving forward with.
Go ahead.
Did Rafael Torres reach out to you, Tina?
Was that the same? Yes, Commissioner Ames, that was the same gentleman. Joellen sent us an
Okay,
email about
because
this.
I
Thank you.
talked to him as well.
We
Yeah.
appreciate that, Commissioner Ames. Again, Scott Richmond, they had a good conversation for direction, so hopefully we're able to pull more qualified applicants, so sincerely appreciate the help with that.
Yeah, I think he's the real deal in terms of, we're going over Friday for a
Oh,
tour.
yes.
Yeah,
It
so-
was nice to hear that he had some previous correctional experience, so he knows the applicants that we're looking for to draw from.
Yep.
So much appreciated.
All good, yep. All right, the only question I had was video court. From a security standpoint, it seems like those numbers are really strong. Is that something that you see growing, or you're appreciative of the fact that it is as strong as it is, or is it too much interruption, or what's your take on video court?
We actually discussed this a little bit at CJAP. Video court is a blessing and a curse. It's a blessing in the fact that we don't have a lot of inmates leaving the facility and coming back. The curse comes with staffing. I think when it was originally thought out, the intent was good, but when we bring people over to the courthouse for court, you have other people doing court administrative functions that don't occur in our facility when we're running it. So when we start talking about staffing, we then have to kind of reallocate different resources to try and accommodate the video court to run it effectively, efficiently, and smoothly. As we, we see what the new looks like with the COVID pandemic and the new Delta variant, et cetera, as we continue to do that, my understanding is there's, of course, a conversation about people would like to see video court stay within the facility. Not opposed as long as we have some help to make sure that we have the staff to run it efficiently and effectively.
So I'm sure it helps from the sheriff's point of view in terms of transport. And you, work release people are helping with that, is my understanding, or something?
Right now, because we don't have a
Right.
work release program, Director Arnold is helping to do that. We've had to pull him in a little bit of tasks to help with the GTL project so we can get that moving. So again, it's sometimes, even if we had just had like somebody maybe from court administration give us a person to try and assist with some of the functions, if we're going to be doing it full-time moving forward until we can plan appropriately for the staffing to accommodate.
Good conversation to have. Yep. Okay. Thank you. Anything further from any of the other departments? No?
And unless anybody has any questions.
I have,
Yeah, go ahead.
I'm sorry, I just have one question. Where do we stand with COVID, which is one of the main reasons we're meeting here instead of at the prison?
Well, knock on wood, our staff has been doing a very good job working and coordinated with Prime Care. We have no positive cases. Now, if I may ask Weber to speak, he educated me this morning about what some other prisons are going through because they kind of pressed the gas pedal a little sooner than what maybe the thought process was that they should have. So if you could speak to that.
Certainly, thank you, Warden. As you know, we have a number of facilities, and 33 of them here in Pennsylvania. Unfortunately, in the last month, we've seen a significant uptick in cases in a number of our facilities, and predominantly it's those facilities that have, so to speak, opened the prison back up, either increasing the ADP, starting a work release program, or bringing groups into the facility, coupled with a number of facilities that did away with masks inside the facility. I believe I sent out to all of our facilities last week a memo regarding the need to slow down. Hopefully, from the experience seen in Europe, the Delta variant burns brightly, but it might burn quickly as well. So if we can hold on for a little bit longer with some more stringent restrictions that we saw, similar to the beginning of the outbreak, we can hopefully get through this without cases. We have noticed if there's an uptick in the community, typically within 2 to 3 weeks, we're going to have it in our facility as well, whether it be one of our staff, CEO, or a new commit who brings it in. But we are testing all new commits when they're brought in. We're still able to quarantine them, so hopefully we're in a position to keep it contained within a relatively small portion of the population. And we are continuing to offer vaccines, and they're likely to have a vaccine clinic here either at the end of this week or the beginning of next week for any detainees or staff members who want to get the vaccine. We have the Johnson & Johnson available to us.
No, I appreciate that, the conservative approach to that. That's awesome. This may come under the heading of blessing and curse also, but the hospital transports, they seem, consistently around 20 a month roughly, but my understanding is that it's because you're trying to screen people coming in so that it doesn't impact the population.
Correct. We're screening them not only for COVID, but for other conditions that they may be experiencing that would require a higher level of care that can be provided in the facility. Unfortunately, with some of the new substances individuals are using and creating, it's not the prison of 20 years ago where someone was brought in because they were publicly intoxicated and you knew it was alcohol and they're likely to sleep it off. A lot of people are coming to us with altered mental state who are unable to determine whether it is as a result of serious mental illness or some impact from a substance. So we'll screen those and make sure that they are healthy enough to be in a correctional facility. Unfortunately, we had to transport another facility last week. We sent them to the hospital. The hospital cleared them. They came back, did their intake, went to sleep, and unfortunately did not wake up because of some substance. The hospital didn't do anything. So you're well aware of the liability concerns that we face, so we have to make sure that these individuals, to the best extent we can, are safe to come in the facility. I do know if in some other areas, if your arresting authorities are starting to get upset because they could bring someone to the jail and then they're turned away and go to the hospital, we do have a memo that details a number of the likely situations that if they come to us, if they've been tased, if obviously gunshot wounds, a visible deformity of a body part, we will be sending those away, and we can provide that to the arresting authorities so that during their staff meetings they can tell if you're going to encounter something like this when you're driving by Good Sam, stop at Good Sam instead of going all the way to because you may have to do a U-turn and come back.
To educate the board, we did have a situation maybe 60 days or so ago. We had an individual that was picked up on a drug raid, was an addict or a user themselves. They got the pre-incarceration check done. They came to us from central booking a little bit later in the day, and then the sheriff and I had an educational conversation with each other through Prime Care. The pre-incarceration check is something that we required to be done for them to be admitted. But at the time, it was done earlier in the day, and then by the time the individual came to the institution, they were still a medical concern. So I think old school in theory was as long as they had the pre-incarceration check done, we would always accept them. And like Mr. Weber just explained, that's not necessarily the case because of the substances. Sometimes the effects of what they absorb into their body, we're seeing adverse effects with them behaviorally, mentally within the facility, not just within the time they come into the intake, 24 hours later, 48 hours later, sometimes 72 hours later, just depending on the make and build of the chemical and the individual. So sometimes we did send the letter or the guide that Prime Care provided us to some of the other arresting authorities to educate them, saying we're not trying to be difficult in this situation, but we are trying to err on the side of caution and be proactive to prevent something bad from happening without them being properly medically screened for us to accept them.
Thank you. Anything else?
No, good.
The only other comment I have is the mental and dental areas seem very strong too, so that those are, emphasis on those is helpful in terms of management of the population as well. So I think that's all.
Prime Care has been a true blessing to Lebanon County Correctional Facility.
Okay, anything else from the floor? Oh, yes, Laura.
Just, are the inmates and staff at the prison wearing masks, or do they not need to wear masks currently?
We provide masks. We ask them to wear masks when they leave the housing unit. The correctional staff are wearing them when they're amongst the population. So that is a requirement. Anybody that's coming into the prison is asked to wear a mask if they're going to be having contact with the incarcerated population.
But when the inmates are in their cells, they don't have to necessarily.
It's something that we encourage, but it's kind of hard to force. I don't want to be put in a situation where we have to go into a use of force situation to ask somebody to do what they're being asked to do. So all we can do is necessarily provide them the tools and continue to educate them to do the right thing.
Okay. If nothing else, I'll ask for a motion to adjourn.
So moved.
Second.
Thank you. We appreciate your input and your attendance, and we stand adjourned.